There is a lot of fear and confusion surrounding the coronavirus called COVID-19, and it doesn't help that some elements of the media have been firing off information many consider fear-mongering. Even a recent Listverse article could be considered as such, but fear is the last thing anyone wants to spread, since even a global pandemic doesn't mean it's the end of the world as we know it. The information on the virus is limited at the moment, as there will need to be a great deal of study before it is fully understood. In the meantime, information is power, so this list contains 10 things you should know about COVID-19 and how best to protect yourself from misconceptions, misunderstandings, and outright media lies about it. COVID-19 is a coronavirus, which means very little to most people who don't work in virology or immunology. The virus itself also has a name, but it's a bit of a mouthful: Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. Regardless, COVID-19 is a coronavirus, and it is spreading, but that's not a cause for alarm. Rather, it's a cause to prepare and protect ourselves in much the same way we do when it's cold and flu season. COVID-19 is likely a zoonotic virus, which means it can be transmitted between animals and people. There are a lot of similarities between COVID-19 and two bat-derived strains of beta coronavirus, which means they are likely related. As time went on, and more research was conducted, Chinese researchers were able to determine that COVID-19 shared 99% of the same genetic information as a similar virus that infects pangolins. Since the first day the world learned about the Wuhan coronavirus, the fear of it spreading began to rise. People have always feared Ebola, but that's far harder to catch than something like a coronavirus, and it's all about what it infects and how it is transmitted. COVID-19 causes a respiratory infection, and it's through a person's respiration that it spreads the easiest. There are two known means by which the virus spreads: person to person and through contact with infected surfaces. In a person-to-person situation, the virus can be spread through close contact, which is generally considered to be a distance of 6 feet. Covering one's mouth when this happens helps alleviate the spread of the disease, and infected people should wear a face mask to reduce the risk of transmitting it to someone else. They are not effective in preventing general public from catching #coronavirus, but if healthcare providers can't get them to care for sick patients, it puts them and our communities at risk. One of the biggest issues with detecting COVID-19 in a patient is that it presents much like the common cold. To combat this, researchers across the globe have been scrambling to come up with a way to test for the presence of the virus, and this has resulted in several different testing methods. One of the best ways to check for the virus isn't to see if you can find the virus in a person's body, it's to find the antibodies the body produces to fight the infection. There are tests currently being used around the world, which look for the virus genetic information in a person's saliva, mouth, nose, and anus. There is no known immunity to COVID-19, which means that everyone is at risk of catching and spreading the infection. COVID-19 can be dangerous, but like most infections, certain portions of the population are more at risk than others. This is one of the reasons the virus has managed to escape the confines of Wuhan, China, to infect the world. Infected people who are asymptomatic become unknown carriers, and even when an otherwise healthy adult does show symptoms, they are often mild and comparative to the common cold. The first part of this block is going to list the symptoms associated with COVID-19 that shouldn't scare anyone, but the last bit will be all about the more dangerous aspects of the disease. Don't be alarmed, as these are the worst-case symptoms that won't affect most people who are infected. Yes, COVID-19 can end a person's life, but that doesn't mean the world will end up like it did in Stephen King's The Stand. If you compare the mortality rate of COVID-19 to something more common like the flu, it's considerably higher. While COVID-19 is much higher than the flu, it presents as a mild infection in the vast majority of people who have had it. If you have concerns about winding up in a place with a lot of potentially infected people, you can avoid traveling and going to events with crowds, but that may not be necessary. One of the reasons there are so many conspiracy theories about viruses like COVID-19 is that few people truly understand it. The virus does have an HIV-like mutation, but that doesn't mean someone weaponized a form of HIV in a lab somewhere and released it upon the world, as some conspiracy theories have stated. That remark has everything to do with the means of fighting the spread of infection, and research like this helps push further research, which could hopefully lead to a cure or vaccine. If you fear you truly did come in contact with someone infected with COVID-19 and are concerned you may have it as well, you need to get tested. This will keep you from passing the virus to other people, so if you have a respirator or surgical mask you can use, do so.